Great to be joined on Flow FM by the Shadow Minister for Health in South Australia, Ashton Hurn. Ashton, good morning.
Good morning, Ricky, and good morning to all of your listeners across South Australia.
Yeah, great to have you with us. And Ashton, you're also the member for Schubert, largely covering the Barossa Valley. We'll talk in a moment about your latest regional travels throughout the state, but this ramping situation was called a crisis for some years, and maybe it still is, according to what's happening. But even though the government claimed they were going to fix it when they were in opposition.
Yeah, look, certainly as I've been travelling around the state and as the Shadow Cabinet team has been travelling around the state, Ricky, people still are wanting to know about what's happening with ramping. I mean, it was the number one issue throughout the state election campaign, and not a day would go by without Peter Malinauskas talking about his promise to fix ramping. But unfortunately, now that the election is over, all of that sense of urgency that he had throughout the election has seemingly evaporated. And, you look at the results and we are in dire straits. Ramping is the worst that it's ever been. It's more than doubled than what it was throughout the height of the election campaign last year. So, look, there's a lot of work that needs to be done. I'd be pleased if Peter Malinauskas could fix ramping like he promised, because at the end of the day, it is not good enough and South Australians are paying the price.
What's the knock-on effect with ramping when it comes to other hospital services, or indeed, say, a regional patient has to be flown down in an emergency? What's the impact having there for our country listeners?
Yeah, well, the ripple effect is enormous, because it means that there is massive bed block. And that means that if people from the country are coming to the city for something serious or something that can't be treated in the region, they're often forced to wait hours upon hours upon hours for a bed. And, I think that is waiting is always a dreadful thing for anyone, let alone when you're away from your family or away from your farm. And then, of course, we've had some new news over the weekend when it comes to wait times for specialists. And, I mean, imagine needing to see a specialist and knowing that in a modern country like Australia that you could be forced to wait up to 7.5 years in pain just waiting to be seen by a specialist. And that's what the new government data shows. And, look, I think that's probably one of the biggest elements that is frustrating, and it's anxious for anyone, let alone if you are in the country, because, when you're on a wait list for such a long period of time, you don't really have any control over when you're going to be called up to be assessed. And if you're managing a farm, you're wondering how you're going to get to town, and also who's going to look after the farm whilst you're away. So we want the government to really come up with a plan to eat through and to chew through those wait times.
Now, you're a regional MP. You've got some ambulances in your area, but you'd be watching closely what's happening in Adelaide. I haven't seen any chalk on the ambulances about the cramping situation you're describing. What's happened with the ambulance union?
Yeah, I think that's a really interesting question, Ricky, and I think that your listeners would have noted that as well, that there is no chalking on the ambulances. And look, I think that there is a level of cynicism that is coming through when you do look back at the action that was taken throughout the election campaign. It was highly politicised. Just to put into context for you and your listeners, in February of last year, which was the last full month of the Marshall government and right throughout the height of the election campaign, patients and paramedics were spending 1,500 hours stuck outside on the ramp. So that is not good enough in itself. But fast forward to where we are currently, and patients are spending 3,500 hours stuck outside of the hospitals on the ramp. And so that's why I think that South Australians are so frustrated with it, because many of your listeners, Ricky, probably voted Labor for the first time based solely on Peter Malinauskas' promise to fix this. And so that's why I think that there really is this element of frustration that they just want Peter Malinauskas to get on with what he said he would, and that is to fix ramping.
Well, something that's also frustrating regional listeners has been the difficulty getting in to see a doctor. Is that part of what you're hearing as part of your regional visits?
Absolutely. And I think our leader, David Spears, has placed an enormous emphasis on making sure that we're getting to every corner of the state, whether it's Port Lincoln on the Eyre Peninsula to the mid-north, and of course to Mount Gambier, which is where as a team, as a Liberal opposition, we are heading today. Access and getting into your GP is one of the biggest frustrations. And it's not being able to get into your GP that does have that massive flow-on effect throughout the system, because if people can't get into their GP or they're told that they need to wait, 6 weeks to get in, well, naturally they start to think, well, what is my next step? And the next step, of course, that people logically have is going to wait those few hours in the emergency department when they don't need to be there, of course, or calling the ambulance. So that really is the ground zero issue, I believe, that we need to be fixing. And, there's conversations that are happening in Canberra just around this Medicare reform, which I actually welcome, because I think we have to start having these complex conversations, because whatever is happening at the moment is just not working. And so we've got to call on the government to really pull every single lever possible so that people who need that care can really get it as close to home as possible.
Is there falling morale in the medical profession in South Australia? You'd flagged, like, in the middle of December, the possibility doctors might leave interstate or being actively poached by Victoria. Is there a risk, now even they're gravitating maybe to suburban areas due to the changes in the Medicare postcode allocations?
Absolutely. I think that change from the Labor federal government was kind of left me and many others scratching their heads, because really one of the biggest challenges for regional people, as we've been talking about, is just having that access to the GP. But not only that, is that in so many of our country areas, it's the local GPs that are ones that are staffing the emergency departments. And so if you make it more attractive to live in the city where, let's be honest, there are more services, if you're making it more attractive for the workforce to go there, well, the loser in that is regional South Australia. And that is why I hope that by having these big national conversations about the Medicare changes and kind of that framework, that we can get some stability back in it, into the system, and that regional South Australia can really start to feel as though they've got those services that they so desperately need back again.
Well, it is a hot potato between federal and state. We'll catch up with your federal colleague Anne Ruston, the Shadow Health Minister federally, about that one very soon. Ashton Hurn, the Shadow Minister for Health in South Australia, thanks so much for joining us today.
Thanks very much, Ricky.